going to be talking about unified messaging for a few upcoming treatment and prevention observances. Here's a little overview of what we're going to cover today. We're going to talk a little bit about the value of utilizing existing toolkits to support our prevention messaging efforts. And then we'll take a look at the SAMHSA Substance Use Disorder Month Toolkit that's going to be for this month in January 2026, followed by the California Department of Public Health Fentanyl Prevention and Overdose Toolkit, which serves as a year-round resource available to us. And then we'll talk a little bit about how to adapt these resources for our local use and best practices for implementation and some next steps. And in addition to the training being recorded today, we'll also be sending out the PowerPoint slides and a supplemental implementation guide that will provide links to local resources to incorporate into the toolkit messaging that you will be posting if you are able to, and some additional resources there. So why is utilizing existing toolkits useful? There's three reasons that we'll talk about. One is just consistency. So we talk a lot about clustering media efforts with our substance use prevention messaging. When we utilize similar messaging, our collective voice is going to be stronger and amplified. These resources and toolkits come with pre-made graphics, social posts, and key messages that are going to save your staff time and you time to really focus on implementation and dissemination into the communities and groups that you work with, and not so much time putting together the graphics. And then lastly, credibility. So utilizing sources from SAMHSA and the California Department of Public Health, they're going to have already done the research and iterative process of making sure that the content is evidence-based, that we can trust and utilize for reaching our communities. I mentioned earlier, but we'll be looking at two toolkits today. The SAMHSA Substance Use Disorder Treatment Month, that's going to be for this month, focusing on treatment, recovery, and reducing stigma. And then the California Department of Public Health Fentanyl Toolkit, again, is going to be a year-round resource focusing on prevention and harm reduction. And together they complement each other, kind of covering the full spectrum from prevention, harm reduction, and then folks that are in their recovery journey and supporting them. We'll start with looking at the SAMHSA Substance Use Disorder Treatment Month Toolkit. This is just a little overview of what you're going to find in the toolkit. There's going to be ready-to-use graphics that are in different formats to support the various platforms that you might be interested in posting on. And they're organized by weekly themes that we'll get into a little bit later. And they have messaging, specific messaging tracks for two groups. There's going to be the general messaging and social media posts focused on community members, families, and individuals seeking help. And then they have another messaging track that's really aimed at reaching our provider communities, so clinicians, case managers, and treatment professionals, to really support them in either becoming like treatment providers or just tips and practices for engaging patients that might be interested in kind of looking at their relationships with substance use. And then there are a few additional templates that they have. They have proclamation templates for local government recognition, if anyone's interested in pursuing that. And then also newsletter templates for your organizational communications, if you were interested in sending out an organization-wide message about Treatment Month. So the Substance Use Disorder Treatment Month was launched in January 2025 as a national observance, so it's newer, with the purpose to raise awareness about available treatment options and reducing stigma that really prevents people from seeking the help that they need. And the timing's intentional by SAMHSA, really looking to capture kind of the new year momentum when people are thinking about positive changes in their lives. With three main goals. So supporting people seeking help, connecting individuals that are thinking about seeking help with resources and the message of hope that help is ready and available. Engaging practitioners, so reaching healthcare providers that are treating or considering treatment substance use disorders in their practices. And then reaching loved ones and community members to really equip them with tools to help those that they might know that are in need of help and support. The toolkit is targeting four main audiences. So those seeking help, healthcare practitioners, friends, family, and loved ones who would like to support people in their lives, and community members and decision makers that are shaping local resources. So we want to keep these audiences in mind when we're selecting which materials to use. Again, there's the 4 weeks that they have content available for, and so you want to make sure you're selecting the post and supporting messages for the different groups that you're most interested in reaching. So the month is organized by weekly themes. The first is going to be starting fresh. So again, really capitalizing on the New Year's energy where a lot of folks are looking to make, positive changes in their lives. Week 2 is looking at the multiple recovery pathways and recognizing that everyone's recovery journey is going to look unique and we need to provide various options to meet folks where they're at. The third week looks at wraparound services and really recognizing that for someone to truly be successful in their recovery, they often need more support than just, addressing the substance use itself. And then the last week looks at treatment-friendly communities and exploring the important role that community and friends and family play in supporting recovery. So now we'll take a look at each weekly theme. So on the right of these next four slides is going to be an example of one of the posts available supporting each week. And then they have pre-written messages as well that you can use or adapt as needed. So week 1 aligns with the natural momentum of January. Again, when people are thinking kind of about fresh starts and positive change, really seeing this as an ideal time to reach individuals that are considering treatment or those that are concerned about loved ones in their lives and their relationships with substance use. Messaging is really going to emphasize that taking the first step, can be really challenging, but it's really a sign of strength and not a weakness, and that help is available. And then the provider specific messaging is going to really be looking to encourage supporting patients by having conversations about their relationship with substance use. And then there's also posts geared towards providers that lets them know that there's a lot of free training resources from SAMHSA for providers to support them in implementing substance use disorder treatment for their patients and practices. And then moving on to week 2, this is going to be emphasizing that recovery is going to look different for everyone. Some folks might find strength through formal treatment pathways, others maybe through faith communities, mutual support meetings, or personal commitment. And so messages are going to look at highlighting FDA-approved medications like buprenorphine and methadone as life-saving tools for opioid use disorder. And the goal is really to reduce stigma around any particular approach and really encouraging community members and providers to meet people where they are and recognizing the value of all the different options that we have for treatment. And for providers, the messaging is going to encourage the medical community to really walk patients through all available options if they're interested in talking about seeking help or supportive services. So talking about everything from holistic services to medication-assisted treatment and providing more than one option, as it's going to look different for everyone. Moving into the third week, it's going to really focus on how recovery is going to depend on the whole person and not just focusing on the substance use alone. So looking at what supportive services are available and wraparound services, considering, how can we provide clients, patients, community members with supportive services around housing, employment, transportation, childcare, and even family programs. So integrating our loved ones into the treatment process can be very helpful for a lot of folks and really can create the stability that people need to focus on healing. And the last week shifts focus to looking at the community's role in supporting recovery. So the post will cover a variety of topics from peer-based recovery support, so looking at how we can connect individuals with others who have lived experience to share stories, hope, and practical guidance as they're getting started. Other things include recovery community centers and advocacy organizations, how they can provide belonging and purpose for folks that are starting their recovery journey. And then encouraging community members how to start conversations with loved ones. That can be really, really hard for folks to kind of broach that topic. And they provide a starting the conversation guide within the toolkit that you can utilize and share out in your messaging as well. And the key message is that people don't need to walk through recovery alone, and that every milestone as people are getting started is worth celebrating. So this slide just gives an overview of the different weekly themes. We're currently in week 1, so the starting fresh theme. And right after today's training, we'll be sending out the implementation guide that will provide a link to the toolkit, which I think my colleague Joe put in the chat as well, that you guys can go ahead and get started if you're interested in sharing any of the content that we covered on your social media platforms or newsletters. Next, we're going to take a look at the California Department of Public Health Fentanyl and Overdose Prevention Toolkit. So this one, again, is going to be a year-round resource that will be available to you and is going to complement the treatment messaging and focus on, reaching the groups that might not be quite ready to enter treatment and focusing on harm reduction practices and keeping folks safe and educating our community on how they can support that as well. A little bit about what's in the toolkit. Again, this is really meant to be as like a ready to use guide so that we don't need to start from scratch for creating content. So there's going to be ready to use social media graphics, fact sheets, and videos. And there's also a lot of specific resources for parents to talk about, again, how to have conversations with teens and young adults. And for this toolkit, most materials are available in Spanish. For the SAMHSA toolkit, I forgot to mention that is only available in English currently. And within the CDPH toolkit, they provide guidance on how to do co-branding, so how to properly add your agency's logo to the resources, which can really help support localizing the content and familiarity as the groups that you'll be reaching out to, know your organizations and groups best. So a little bit about the toolkit. This is going to be focused on increasing awareness about fentanyl and overdose prevention, reducing stigma, and really talking about practical tools for saving lives as community members and those who might be using substances. It's going to cover a variety of focus areas, including recognizing overdose, naloxone access, harm reduction strategies, and connecting to recovery support as well. The toolkit's organized around 5 core prevention messages. We'll go a little bit more into each of these over the next slides, but these are really the backbone of the California Department of Public Health's approach with this toolkit. So first is knowing the signs of overdoses, the importance of carrying naloxone, educating about how we can know what's in our drugs through test strips, the importance of never using alone, and having conversations early and often. Again, that's more focused towards our youth and young adults for adults and parent role models. So we'll take a little bit closer look at each of the messages. The first one is knowing the signs of overdose. So for the content that's created around this, it's going to really go over the warning signs of overdoses and how to respond if you see the signs. So for warning signs, teaching folks really to be looking for unresponsiveness, slower stopped breathing, any choking or gurgling sounds, and discolored skin. And there's going to be a lot of images and practical, easy to understand posts around these topics as well. And then educating the community on what to do if they see these signs, the importance of calling 911, providing naloxone if it's available, performing rescue breathing, and they also have content geared around kind of what that looks like for folks who aren't familiar with rescue breathing, and then encouraging to stay with the person until help arrives, and the value that quick recognition can save a life. The second core message is the importance of carrying naloxone. So the posts go over that naloxone is now available over the counter without a prescription needed at most pharmacies, and who should carry it, which really, comes down to everyone in the community, from people who use drugs, family members, friends, first responders, and community members. It really educates that naloxone is safe and easy to use, and that there won't be any harm if it's administered when opioids aren't present. And then we also want to highlight that San Diego County has a lot of free access points for naloxone, because while it is available over the counter at pharmacies, there's oftentimes a copay or a cost associated, which might be, prohibitive for folks in accessing naloxone or carrying it. We have a lot of access points to free naloxone in the county. So over on the right, that's going to highlight a few resources that will also be included in the guide that we send out after today's training. But the San Diego County Access and Crisis Line, the San Diego County Substance Use and Overdose Prevention Task Force also developed an interactive naloxone and treatment map. So you can put in a zip code and it'll show you where you can access naloxone or medication-assisted treatment locations nearby. And then the county naloxone page, which will have additional educational resources and information about access points. And there's also the San Diego Opioid Project is another local resource that has developed some naloxone information cards that are available in 5 different languages, and all of those are going to be included in the resource guide as well. And I know that a lot of our regional prevention providers also serve as access points for naloxone in the community and provide overdose education and training. So if you are a regional provider that offers that service and you're on the training, I encourage you to put your contact information in the chat for anyone, community members who might be interested in reaching out to you for that resource as well. Moving on to the next key message, it's really focusing on encouraging folks who use drugs to know what's in the drugs that they're using. Fentanyl can often be mixed with other drugs without the person knowing, and there are test strips available for fentanyl and xylazine that can be a tool to help identify these substances before using. These test strips are available at harm reduction sites, and some pharmacies offer them as well. And what really the messaging that is available around this in the toolkit really focuses on the framing that test strips don't encourage drug use. They're another tool to help keep folks alive while they might not be ready yet to access treatment. And again, many of the regional providers, at least some of them, can also provide information on fentanyl test strip access as well. So we encourage you to utilize them as a resource. And then I mentioned the San Diego Opioid Project earlier when we were talking about naloxone, and they also have really easy to understand resource cards developed, available in 5 different languages, that you can utilize and share through your messaging as well. And those are going to be in the resource guide we share out too. The fourth message that the toolkit focuses on is never use alone, recognizing that most overdose deaths happen when people are alone and no one can either intervene through calling 911 or administering naloxone. So having someone present who can call 911 if needed and give naloxone dramatically increases survival in the event of an overdose. And it also provides information for those who might not have someone around when they're going to be using. The Never Use Alone hotline is another resource that's available 24/7. They're trained operators that will stay on the line while someone is going to be using substances, and they'll get information about, where the person's located, making sure that there's easy access in the event of an overdose, If the person's on the line and becomes unresponsive, the operator will call for emergency services to come out to them. And the fifth core message of this campaign is, again, focused around having conversations. This is really focused towards, parents, guardians, adult role models for youth and young adults. So covering topics like starting conversations early and often, not waiting until there's a problem present, but starting these conversations early is really valuable. The importance of creating a safe and supportive environment as taking kind of a more punitive approach can create an environment where our youth and young adults don't feel comfortable coming up and talking to us or asking for help if a situation arrives. And focusing on safety first and really explaining the risks of things like counterfeit pills or just substances that may be containing lethal doses of fentanyl. And the toolkit also provides excuse me, resources as well to give more information to parents and adult role models that are linked on the slide that'll be shared out after today's training. So now we're going to talk a little bit about how we can take these resources and adapt them for San Diego County. There's, four simple steps to make them ready for use in a local context. First, you're going to want to sit down with your team or whoever's, going to be doing the social media communications for your organization and really think about kind of who are the different audiences that were in mind when these messages were created and choosing the relevant content for your audience and region. And then taking time to customize the message. These are great resources that have pre-written post and copy available to use, but taking some time to, adjust the message as needed because you all know your community groups best. So updating things like having your logo there and local context and resources will be really helpful. And then coordination. So for those that aren't familiar, we have a monthly countywide media advocacy meeting where it's a space where the regional prevention providers can talk about kind of what they're doing locally in their region, can talk about how we can better coordinate media messaging across and share resources to increase our coordination and impact. And I'll share the information about those meetings in a later slide if you're not one of the regional providers, but you're interested in joining and kind of talking about any messaging concerns or practices that you would like support with, we're happy to have you join as well. So when customizing the resources, we want to always make sure to include San Diego County resources. The national resources are wonderful to include as well, but having the local context is going to be really important. We always encourage folks to include the San Diego County Access and Crisis Line. It's available 24/7. And then on the right are some additional local resources to consider including. There's the San Diego County Substance Use Outpatient Services. The Substance Use and Overdose Prevention Task Force, again, also has the treatment locator map, which is a great resource for folks to have access to. The San Diego Opioid Project additionally has information about naloxone and fentanyl test strips and also has done a lot of wonderful communication campaigns for San Diego County. And then there's also the Own Your Mindset campaign for youth-focused messaging. So as I mentioned earlier, we encourage coordination of the media-related efforts through our monthly meetings. They're held on the third Thursdays at 10 a.m. And they're really a place to coordinate messaging efforts around substance use within our regional prevention system and also community partners. So if you are a community organization or just interested in joining the meeting, our contact information will be on the last slide. We encourage you to send an email to us and we're happy to provide the meeting information to you all because there's a lot of value in taking time to kind of talk about maybe any issues that you've experienced with messaging and how, there's other people on the call who've likely been through similar situations and can provide tips and tricks for solutions. So it's a great space for brainstorming and really taking time to coordinate efforts can help increase our visibility and reach. avoid duplication because there's a lot of wonderful resources already developed that you might learn about. And then cross promoting our content to extend our reach is also another practice that we encourage, and just a space to share learning so we all can, improve our media efforts. And our next meeting, I believe, is on January 15th, so next week. So we'll just talk a little bit about best practices for implementation and messaging guidelines. So we really want to make sure that we're leading with hope that, recovery is possible and happening, utilizing person first language. So that just means, rather than saying addict, saying, person with a substance use disorder, to really just, be humanizing and approachable. We want to be trauma informed with a compassionate and non-judgmental tone, and stay evidence-based and make sure that we're citing reliable sources. And a few things we want to avoid is we want to focus on using the person first language and avoiding any stigmatizing terms when we're providing communication on these topics. And we want to focus not only on crisis, but also on the hope and recovery that is happening and the resources available. We want to avoid any shame or blame, really recognizing that, substance use disorder is a medical condition and not, a moral failing or a choice. And avoiding scare tactics and really making sure that we're being fact-based in our messaging as well. So these are the links to the toolkits that we talked about today. They're in the chat, and they'll also be included in the resources that we share right after today's training. And we have another training coming up. It'll be on February 26th at 11 a.m. We'll be having the flyer sent out with registration within a few weeks, but this will be a time that Rescue Agency will be providing some updates on the social media campaigns that they've been conducting for the county surrounding topics around overdose and mental health. So that'll be a great time to kind of learn about what they've been doing and the resources available to you all to include in your social media efforts. So that concludes the content that we had planned for you all today. Our email is on there if you have any, technical assistance needs, questions about social media or any of the content that we went over today. Now's a great time to ask any questions, but if something comes up later, please don't hesitate to reach out. We're here to help and support you all in your messaging efforts. And again, if any of you are interested in attending our monthly coordination meeting, just please send an email to CWMA@ccrconsulting.org, and we'd be more than happy to have you join us.